Why do PET scans use standardized uptake value? Imagine trying to compare how different parts of the brain use energy or how tumors grow in different patients. Without a common measuring stick, it would be like comparing apples to oranges. That's where the standardized uptake value, or SUV, comes into play. PET scans, which stand for positron emission tomography scans, use a special radioactive tracer called fluorodeoxyglucose, or FDG, to see how active tissues are. FDG is a sugar-like molecule that gets taken up more by cells that are working harder, like cancer cells or brain regions with high activity. The SUV is a number that tells us how much of this tracer has accumulated in a specific area, relative to how much was injected and the patient's size. It's like a score that makes comparing different scans easier. The main reason we use SUV is to make sense of the data across different patients and over time. Because each person's body size and the amount of tracer injected can vary, raw numbers aren't very helpful. SUV normalizes these differences, giving a fair comparison. For example, if one patient has a high SUV in a brain tumor, it suggests the tumor is very active metabolically. If another patient has a lower SUV in a different area, it helps doctors understand whether that tissue is normal or abnormal. This standardization makes it easier to track changes, like how a tumor responds to treatment. Another key reason for using SUV is that it provides a simple, numerical way to assess metabolic activity. Instead of just looking at images, clinicians get a clear number that indicates how much energy the tissue is using. This helps in diagnosing conditions like cancer, Alzheimer's disease, or inflammation. For example, high SUVs in certain brain regions can point to neurodegenerative issues, while very high SUVs in a tumor can confirm malignancy. It's a quick and effective way to get a snapshot of what's happening inside the body. SUV also makes PET scans more practical for everyday use. Calculating it doesn't require invasive procedures like drawing blood during the scan. Instead, it uses data from the scan itself and the known dose of tracer injected. This simplicity allows doctors to perform these scans regularly, especially in brain mapping and diagnostics, where monitoring changes over time is important. It's a tool that helps researchers and clinicians see how the brain functions or how diseases progress. In brain mapping, SUV helps identify abnormal activity or areas of damage. For example, in Alzheimer's disease, certain brain regions show decreased SUV, indicating less activity. In cancer diagnostics, elevated SUVs can reveal hidden tumors or metastases. This measurement supports decisions about treatment plans and helps track how well therapies are working. Of course, SUV isn't perfect. It can be influenced by factors like how long after the tracer is injected, the patient's metabolism, or even how the scanner is calibrated. That's why standard protocols and careful interpretation by specialists are essential. They ensure the SUV values are accurate and meaningful. To sum up, PET scans use the standardized uptake value because it offers a consistent, easy-to-understand way to measure how much tracer a tissue takes up. This helps compare different scans, assess tissue activity, and monitor changes over time. It's a simple yet powerful tool that supports brain mapping, diagnostics, and research in neurotechnology.